How to cure heartburn. Heartburn is a burning pain in your chest just behind your breastbone. The pain is often worse after eating, in the evening, or when lying down or bending over. Occasional heartburn is common and no cause for alarm. Most people can manage the discomfort of heartburn on their own with lifestyle changes and over-the-counter medications. Heartburn that is more frequent or interferes with your daily routine may be a symptom of a more serious condition that requires medical care. How common is heartburn? Occasional heartburn is fairly common. However, if you have regular and severe heartburn, it can actually be an indicator of a chronic acid reflux condition called GERD. You should talk to your healthcare provider if you frequently experience heartburn. What does heartburn feel like? Heartburn typically feels like a burning in the center of your chest, behind your breastbone. When you have heartburn, you may also feel symptoms like a burning feeling in your chest that can last anywhere from a few minutes to a couple of hours, pain in your chest when you bend over or lay down, a burning feeling in your throat, a hot, sour, acidic, or salty taste at the back of your throat, and difficulty swallowing. Symptoms of heartburn. Symptoms of heartburn include a burning pain in the chest that usually occurs after eating and may occur at night, pain that worsens when lying down or bending over, bitter or acidic taste in the mouth. Causes of heartburn. Heartburn is common and can be used or made worse by lifestyle choices and physical issues, including certain foods and drinks, being overweight, overeating, smoking, stress and anxiety, pregnancy, certain medicines, a hiatal hernia. We'll go over some quick tips to get rid of heartburn, including wearing loose clothing, standing up straight, elevating your upper body, mixing baking soda with water, trying ginger, taking licorice supplements, sipping apple cider vinegar, chewing gum to help dilute acid, staying away from cigarette smoke, and trying over-the-counter medications. Risk factors. Certain foods and drinks can trigger heartburn in some people, including spicy foods, onions, citrus products, tomato products like ketchup, fatty or fried foods, peppermint, chocolate, alcohol, carbonated beverages, coffee or other caffeinated beverages, and large or fatty meals. Being overweight or pregnant can also increase your risk of experiencing heartburn. Complications. Heartburn that occurs frequently and interferes with your routine is considered gastroesophageal reflux disease or GERD. GERD treatment may require prescription medications and occasionally surgery or other procedures. GERD can seriously damage your esophagus or lead to precancerous changes in the esophagus called Barrett's esophagus. To determine if your heartburn is a symptom of GERD, your doctor may recommend X-ray to view the shape and condition of your esophagus and stomach, endoscopy to check for abnormalities in your esophagus. A tissue sample or biopsy may be taken for analysis. Ambulatory acid probe tests to identify when and for how long stomach acid backs up into your esophagus. An acid monitor that is placed in your esophagus connects to a small computer that you wear around your waist or on a strap over your shoulder. Esophageal motility testing to measure movement and pressure in your esophagus. Strategies for heartburn relief. There are a number of home remedies and lifestyle changes that will help you prevent or even eliminate heartburn. Here are my heartburn remedies. Avoid foods that cause heartburn. While foods that trigger heartburn can vary from person to person, there are a number of foods that are known causes of heartburn, including spicy food like hot chili peppers, acidic food like coffee, citrus fruits, tomatoes, and chocolate, peppermint, fatty foods, caffeine, carbonated beverages, wine, and other alcoholic beverages. Pay attention to the food that trigger heartburn for you and eliminate them from your diet. Increase probiotics. An imbalance of beneficial bacteria in your gut may be contributing to heartburn symptoms. It's common to think acid reflux is caused by an excess of stomach acid, when in fact it may be that not enough acid is in your stomach to digest food. Learn how to improve your gut health by including gut-friendly prebiotics and probiotic food to your diet, which can help ensure that you have enough stomach acid for proper digestion. Don't smoke. The nicotine from smoking and vaping can irritate your esophagus and may weaken the valve between the esophagus and stomach, allowing the stomach acid to back up into the esophagus. Maintain a healthy weight. Excess weight may put too much pressure on your stomach, which in turn may loosen the valve and allow stomach acid to escape. Practice portion control. When you overeat, your stomach has to stretch, which can weaken the valve leading to the esophagus. Try eating smaller, more frequent meals to avoid stretching of your stomach. Avoid late-night eating. Laying down or going to bed on a full stomach can cause heartburn. Wait at least 3 hours after eating before you go to bed to give your stomach a chance to empty itself. You can also try raising the end of your bed so your chest and head are above your waist. This helps to prevent stomach acid from traveling up toward your throat. Treatments for heartburn. There are a number of treatments to help relieve heartburn, including natural remedies that you can try at home and over-the-counter medications that can offer instant heartburn relief. Treatment. Many over-the-counter medications can help relieve heartburn. The options include antacids, which help neutralize stomach acids. Antacids may provide quick relief, but they can't heal an esophagus damaged by stomach acid. H2 receptor antagonists, or H2RAs, which can reduce stomach acid. H2RAs don't act as quickly as antacids, but may provide longer relief. Proton pump inhibitors, such as lansoprazole, like Prevacid 24-hour, or omeprazole, like Nexium 24-hour, Prilosec OTC, which can also reduce stomach acid. If over-the-counter treatments don't work or you rely on them often, see your doctor. You may need prescription medication and further testing. How do antacids work to treat heartburn? Antacids reduce the amount of stomach acid, relieving your heartburn. These medications can also be used to soothe stomach upset, indigestion, and other pains in your stomach. Some antacids contain simethicone, which reduces gas. Antacids that can get you without a prescription include Tums, Rolaids, Malox, Gaviscon. Make sure you always follow the instructions on the package or talk to your doctor about the right way to use an antacid. If you use tablets, chew them well before swallowing for faster relief. Are there any side effects of antacids? Some antacids contain magnesium or sodium bicarbonate, which can act like a laxative. Do not take antacids if you have any symptoms of appendicitis or bowel inflammation. Side effects of antacids may include constipation, diarrhea, white or pale bowel movements, stomach cramps. Serious side effects can occur with an overdose or overuse of antacids. How do acid blockers work to treat heartburn? Products like Pepcid AC are called histamine H2 blockers or acid blockers. Acid blockers reduce the production of stomach acid. They relieve heartburn, acid indigestion, and sour stomach. Always follow the directions on the packaging or talk to your healthcare provider about how to take this medication. Acid blockers you can buy without a prescription include Pepcid AC, Tagamet H, Tagamet HB. Take your acid blocker medicine regularly for as long as directed by your healthcare provider, even if you do not have any pain or if your symptoms even get better. Stronger acid blockers are prescription medications. These can be used to block stomach acid, treat stomach and duodenal ulcers, erosive esophagitis, and GERD. They work by reducing the production of stomach acid. Your healthcare provider will give you a specific prescription for this type of acid blocker. The United States Food and Drug Administration, FDA, recently reported elevated levels of a possible carcinogen NDMA in the drugs ranitidine like Zantac and nizatidine like Axid. You should speak to your healthcare provider if you're taking one of these medications. Are there any side effects of acid blockers? Side effects of acid blockers include headache, dizziness, diarrhea. If you have any of the following possible serious side effects after taking acid blockers, tell your healthcare provider right away. Confusion, chest tightness, bleeding, sore throat, fever, irregular heartbeat, weakness, or unusual fatigue. Natural remedy. Use baking soda. You may find relief from infrequent heartburn with sodium bicarbonate, otherwise known as baking soda. Simply mix 1/2 teaspoon with 4 ounces of water to help neutralize the acid. Note this contains sodium and should not be used if you are on a sodium-restricted diet. Check with your doctor if you're taking any prescription drugs, are pregnant, or have a chronic health condition before using baking soda to relieve heartburn. Over-the-counter medications. Calcium-based antacids are ideal heartburn relief for infrequent sufferers. H2 blockers, or histamine H2 receptor antagonist, and proton pump inhibitors reduce the amount of acid produced by the stomach and help to prevent heartburn for those who suffer from heartburn on a more frequent basis. These drugs should not be taken indefinitely without checking with your doctor. If you have frequent heartburn for more than 6 weeks, if these treatments don't help relieve your heartburn, you should see your general practice doctor. When to seek care for heartburn. Don't ignore heartburn. Stomach acid can damage your esophagus and increase your risk of cancer. Sometimes natural remedies and over-the-counter medications are not enough to reduce your symptoms of heartburn, and prescription medications may be necessary. An everyday online visit is a convenience option for diagnosis and treatment of heartburn, as well as to help determine if your heartburn symptoms point to acid reflux or GERD, which is gastroesophageal reflux disease. Schedule a virtual visit with a general practice doctor if lifestyle changes and medicines are not helping. If you have heartburn 3 to 4 times a week, or if you have other symptoms such as food getting stuck in your throat, vomiting, or unintentional weight loss. If you have more severe symptoms such as chest pain, dark-colored coffee ground vomit, black stools, persistent vomiting, or if you feel like you're choking, seek care in the emergency room right away. What to expect from your doctor. Your doctor is likely to ask you a number of questions. Being ready to answer them may make time to go over points you want to spend more time on. You may be asked, when did you first begin experiencing symptoms and how severe are they? Have your symptoms been continuous or occasional? What, if anything, seems to improve or worsen your symptoms? Are they worse after meals or lying down? Do your symptoms wake you up at night? Does food or sour material ever come up at the back of your throat? Do you experience nausea or vomiting? Do you have difficulty swallowing? Have you lost or gained weight? What can you do in the meantime? Try lifestyle changes to control your symptoms until you see your doctor. For instance, avoid food that trigger your heartburn and avoid eating at least 2 hours before bedtime. In the end, make sure to share your experience with us and don't forget to subscribe, share, and like.